Week 9 presentation for ME105. We are really getting down to it, my friends. We are in the final weeks of our course, so please remain diligent with your studying and your commitment to your work and turning it in on time because it will pay off. Definitely don't stop now. We're not quite done. There's still points to be had, so make sure you finish strong. Let's dive right in today. This week we have one chapter to focus on, which is kind of a nice thing. Chapter 11, which is the reproductive system. So let's go through the different word roots you may need to be familiar with in terms of the reproductive system. And I have them identified male versus female on here. Peni, phalli, those all will refer to the penis. Orcho, orchido, testi, and testo are going to refer to the testicles. Oophoro and ovario are going to refer to the ovaries. Salpingo is the one that sometimes people get confused on. Salpingo is going to refer to the fallopian tubes. Hystero, metro, metrio, and utero are all going to refer to the uterus. Vagino and calopo are going to refer to the vagina, and placento is going to refer to the placenta. Do make sure you familiarize yourself with both the male as well as the female reproductive system in terms of their parts and functions. There's just a few things that I'm going to point out, and it looks like it's on the female reproductive system, so let's go ahead and go to that. In terms of the uterus, there are 3 layers of tissue in the uterus. The perimetrium, the myometrium, and the endometrium. The endometrium is going to be the most inner layer. The myometrium, which is the muscular layer, is going to be the middle layer. And the perimetrium is going to be the outer layer. One term I want you to be familiar with is intrauterine. That's going to mean within the uterus. The female breast is considered part of the female reproductive system. So, it's good to remember that each female breast is located over the pectoralis major muscle. The areola is one part that your quiz asks a question about. That's the circular pigmented area of the skin around the nipple. One test to be familiar with is the mammogram. So mammograms are a very important study to check the female breast and also the male breast for breast cancer. Both males and females can get breast cancer, although it's more common for women than men. So mammograms for women, according to the American Cancer Society, are recommended annually beginning at age 40. So that is an important tidbit to remember as well. Terms related to pregnancy and delivery. Obviously, not everything's on here. It's just the most important and the facts that I want you to kind of focus on for your quiz. And the term embryo actually means young one if you look up the actual meaning of that word. But it is considered the first 8 weeks of pregnancy. After that point, the baby is considered a fetus until it's born. Prenatal vitamins are something we often kind of forget about unless we're pregnant and taking them. But if you think of the term prenatal, you can figure out that this is something that you take while you're pregnant. And it helps the woman get the necessary nutrients and vitamins and all of that stuff that is needed and in the right volumes to help that growing fetus and embryo. But the vaginal canal, that's an adjective referring to the birth canal. So the same thing, vaginal canal, birth canal. Breech, let's talk about that. If you've ever had a breech baby, you probably definitely know what this term means. I'm sure it's not something you easily forget. I happen to have 2 children, and neither of my children were breech, so I feel pretty fortunate. If the buttocks, knees, or feet of the fetus enter the mother's pelvis during labor first, that is considered a breech presentation. Ultrasound, something very important during pregnancy, and it's done at regular intervals to check the growth and the development of the fetus. So ultrasound provides a picture using sound waves or ultrasonography of that developing fetus so they can check for things even before the baby is born. A couple of surgical procedures that I want you to be aware of. A D&C is something that definitely I want you to know. The purpose of it is it expands the cervical opening so that the uterine wall can be scraped. Sometimes we hear of a D&C after a woman has a miscarriage, and often they'll have to go in and actually clean the wall of the uterus. An oophorectomy, if we kind of divide that word out, we can pretty much figure out what this means, but it's a surgical procedure to remove the ovaries. Another thing to remember in terms of female reproduction is menstruation. It's also known as menses, so if you hear either term, they can be used interchangeably. There's another related term that I want you to know, and it's metrorrhagia. That's bleeding from the uterus at any time other than during the menstrual period. So that would indicate that there could possibly be a problem that needs to be looked into further. And some additional conditions to know. And I do have male versus female, and then could happen to both male and female. So endometriosis, that's a condition in which the tissue of the endometrium, which again is part of the uterus, is somewhat resembling the endometrium, and it occurs abnormally in the pelvic cavity. So there's a condition in which tissue that maybe shouldn't be there resembles that endometrium but is not, and it's growing abnormally and occurs abnormally in that cavity. Cervicocolpoitis, that's an inflammation of the cervix as well as the vagina, so it's both. If it was just the cervix, it would be a different term. If it was just the vagina, it would be a different term. But when we have them both, we have cervicocolpoitis. In terms of the male, one term I want you to be familiar with is orchitis, and that's inflammation of the testicle. And then in terms of something that can affect both males and females, one sexually transmitted disease that your quiz does ask about is gonorrhea. They ask about the causative agent, which is the root cause of it. And it is a word that it's like crazy to even try to remember, so you might want to jot it down. But it is listed on here. It's a type of bacteria. Gonococcus is the name in terms of what we usually hear, and then we have the scientific name that's also spelled out there for you. Women, interestingly enough, are often asymptomatic, which means they will not experience symptoms to alert them that they have this condition. So often, sometimes it goes untreated. So it is something to obviously be aware of, and then to know what to do if it does happen to you. So it's something to definitely read up on in your textbook if you need further information. Short and sweet today, I know, which is kind of awesome, I think. Week 9 tends to be a heavy hitter, so definitely look over your assignments, see what's due. If you have questions, definitely reach out. Remember, week 10 is a little bit different, so watch for announcements in terms of the due dates for week 9 and 10. I believe the week 9 announcement also includes the due date for week 10, so definitely read those announcements in the classroom. And if you have any questions regarding any of that, definitely reach out to me. I want to make sure everyone has their work in on time, not only for week 9, but also week 10. Other than that, all the information presented today did come from your textbook. Definitely use that as a reference source for you. And thank you for your time today, and I look forward to seeing your work come through. Have a great day.